So I'm Stephen once again, and now I'm going to show you how to set up your match settings so that Wendy knows who to match you with, who to schedule, who to screen out, etc. So part one of this, when you're in your dashboard, go to provider information, confirm this is all correct. What type of provider are you? If you are a group practice with multiple providers, we'll be able to deal with that in a minute. So just make sure that you pick the right type of provider that's the main driver of your account. This could just be you. What are you? But select your provider type. Make sure all of this is accurate. You can add your credentials, though they don't really affect anything. And the main thing here is that you're going to go to your match criteria settings. So plug in every single clinical issue that you treat. If you're a group practice, make this reflective of your entire group, not just you as an individual or one of your providers, but every single issue your practice treats. These issues derive from the provider type selected. So I'll click out of coach, for example, and let's click acupuncturist. So if your provider type is that of an acupuncturist, you will have a long list of acupuncture issues that you can select from. And now Wendy knows that when somebody needs moxibustion, you can treat them. If you treat issues or commonly see issues that are not on this list, then you can play with this and select other provider types. So, for example, if you are let's say you're a mental health practice, you're a psychotherapist, but you don't see a particular issue on your list, maybe try looking up the psychiatrist list. So click psychiatrist, and now you have a few different provider types selected, and your issue expands because now you have every single issue that's also on the psychiatric list. So you can kind of play with this. The main provider type is the one you selected on your provider settings, but you can add other provider types just so you can access the issues that they treat. Now, I should note one more thing too, that the provider type you select here under provider information, that will be the list that your patients see. So even though you can add a bunch of issues, the main list is going to be the list that stems from the, say, coach provider type. If you add issues from the cardiologist list, the entire cardiologist list will not display to your patients because that wouldn't make sense. But the specific issues that you selected will then just be included on your list. So moving on, are you a cash pay only practice? If so, toggle this on and it will just nullify and void any insurance logic that's built into the Wendi system. Are you in network with any payers? So only do payers you're in network with, meaning HMOs you can take, plug them in here. If you're in network with payers that are not on our list, which does happen sometimes, though it is rare, just let us know and we will work to get it added. So build out a list of all the payers you're in network with. Can you accept Medicaid patients? Now, if you can, but they are private Medicaid plans, like Anthem Blue Cross Medicaid plan, for example, you could turn this on, but then it's going to match you with anybody who says they have Medicaid. Your better bet would be to find the payer in here and just select that you are in network with them. But if you can take just like Alabama Medicaid, for example, turn this on, select the area, and now Wendy can match you with those people. What is your session rate? You can override this later if you don't want Wendy telling anybody. Otherwise, plug in your session rate. Think of this as your private pay rate for a patient's first appointment. If you're a simpler practice, or like a mental health practice, or you have this standardized, so like every first appointment just costs the same, plug that in here. If you have a more complex practice where there are a bunch of different potential services you offer and they all have different prices, and you don't know that, you don't know early on, or Wendi can't know early on which one somebody needs to schedule, you can plug something in here, but you can override it later. Fill in all of this, and now Wendi has what she needs to effectively match you with prospective patients.